Mrs. Lepage is a resident of the long-term care home where you work. She suffers from cognitive impairment but is mobile and takes part in personal care with clear instructions. You are the PSW in charge of Mrs. Lepage today for general personal care at the washroom. The PSW proceeds with hand hygiene prior to taking the user to the washroom. She has installed a chair in front of the sink covered with a towel. Once the user is seated, the PSW fills the sink with warm water. The personal care items are also placed within reach. The required steps prior to care have also been completed: procedure, user identity check, introduction, getting the user's agreement to receiving care. Ask the user if they need to use the toilet before taking them to the washroom, making sure to respect their privacy.
Mrs. Lepage, this morning we'll be getting you washed up and dressed up so you'll be ready for the day.
Okay. Yeah.
Perfect. We'll be starting you, okay, with the face, okay?
Okay.
I'll be taking your glasses. Your face.
Encourage the user to do what she can do for herself. This helps maintain a level of mobility and autonomy. In this case, the user needs clear instructions due to the cognitive impairment, but is able to carry out personal care activities with the assistance of a PSW, one step at a time.
Next step, we'll be taking your nightshirt off.
Okay.
We'll be putting a towel around you to keep you warm
Okay.
and washing your arms.
The PSW tells the user about the next steps to encourage her cooperation, especially when the user suffers from cognitive impairment. Moreover, giving clear instructions as to the steps to follow tends to encourage cooperation and reduce anxiety. The PSW removes the user's nightshirt and covers her with a towel to keep her warm and protect her privacy. If necessary, she instructs the user as to the steps to follow: wash, rinse, and dry, to encourage the user to do it by herself. The PSW instructs the user to apply deodorant or helps with the application if the user is having difficulty.
I'm going to let you wash your arms,
Okay.
one arm at a time. Here's the one with the soap, okay?
Okay. Like this.
That's perfect. That's great. Next arm. That's awesome. Now we're going to rinse. All right? First arm, left arm. That's all the soap. The other arm now, yes. We're all good. I'm going to give you a towel to dry your arms, and then we'll put your deodorant.
Okay.
Time to dry. Perfect. Last step for the arms, we're going to put your deodorant on. Are you able to put it on yourself? Next step, I'm going to get you to wash your torso. Wash everywhere, okay? Under the breast, everywhere in the belly. All right?
Okay. Yeah.
Keeping the user covered with a towel, the PSW instructs the user to wash her thorax, making sure the folds in the belly and under the breasts are properly washed, rinsed, and dried. Leftover soap or moisture can cause irritation and other skin issues. Any redness or other abnormal looking skin should be referred to the nursing staff.
Now we'll be rinsing the soap, okay? I'm going to let you rinse all the soap with this,
Okay.
okay? Under the breast, yes.
Yeah.
Everywhere on the stomach, perfect. Last step, I'm going to ask you to dry everything. Okay, again, under the breast, everywhere on your abdomen. Perfect. That's great. What we'll be doing now, I'm going to switch, okay, this over to the front, and I'll be washing your back.
Oh, okay. Yeah.
All right? Same steps, and then I'll be putting cream on your back.
The back is washed with the towel covering the thorax. This is also an opportunity to apply moisturizing lotion to the back to preserve healthy skin. Afterwards, help the user put on a clean nightshirt.
I'm rinsing. Now I'll be putting some cream on. Okay. I'm going to let you help me, and we'll be putting your nightshirt back on, your new nightshirt on.
Oh, okay.
Okay, we'll take this off.
Yeah.
Okay, put your arms in, one arm at a time. That's great. Feeling better?
Yeah.
Perfect. So I'll be doing your leg and your foot.
Okay.
To wash the user's legs, the PSW needs to squat, bending at the knees to keep her back straight. She washes the legs from the bottom up, making sure to clean between the toes. She rinses and dries thoroughly.
Washing your feet. Between the toes. I'm going to rinse off your legs. Rinse your feet between your toes. So we'll be rinsing everything off. Between your toes. Working on your legs. Perfect. We'll be going on to the next step.
Okay.
Mrs. Lepage, the next steps will be getting your genitals done and then your buttock. We're
Okay.
going to start with your genitals.
Mm-hmm.
Are you able to do them yourself?
I think so.
Perfect. So what you have to do is go from front to back. Okay? Change sides, change corners, front to back again.
Okay.
That's good for you?
Change side, change corner. Okay.
Exactly.
Uh-huh.
All right? Same steps, same 3 steps as the rest of the body. Perfect. So I'm going to help you get up.
The PSW helps the user stand up. Because Mrs. Lepage suffers from cognitive impairment, she needs clear instructions to stand and use an armrest, a grab bar, or the sink to steady herself. The PSW washes the user's perineum and buttocks. Female genitals must always be cleaned front to back as follows. The caregiver washes the greater lips, separates the greater lips from the lesser lips, and washes carefully with a clean section of the washcloth for each movement. She adjusts her method in accordance with the user's standing position. Also, if the user is able and willing, the PSW can let her wash her genitals by herself. Men's genitals must be cleaned as follows. Dilate the foreskin, wash and rinse the glans penis with a circular motion towards the tip. Dry with a clean towel. Wash the rest of the penis and scrotum. Rinse and dry the area, making sure to leave no soap residue or moisture. Any anomaly must be reported to the nursing staff.
Great. I'll be doing your buttock. You just stand down, sit back down, hold your chair. Perfect. Are you okay? Comfortable?
Yeah.
Since you're needing help to get dressed, we'll be doing it together. She'll be helping you. We'll start by putting your depends on.
Okay.
We'll stand up, put it all back in, and then put your socks on.
Okay.
The PSW makes sure to keep her back straight when bending down to help the user put on her panties. Then, she asks her to stand up to properly adjust the panties. Panties are used to protect the user against urinary incontinence. Mesh panties can also be used. Once the panties are properly adjusted, the PSW helps the user put on her socks and slippers. Slippers are recommended to prevent slipping and falling.
Is that comfortable?
Yeah.
Okay, sit back down, take your armrest. You're good? Right. I'll be putting your socks on.
At the end of the personal care, the PSW helps the user regain her wheelchair if needed. She then proceeds to clean up the sink and surrounding surfaces where splashing water may have occurred. Disinfection is required if the washroom is a shared facility.